The principle of veracity tells us that we have the duty to tell the truth. That is so because telling the truth has moral value. Veracity means truthfulness, so we're saying that the principle of veracity requires us to be truthful and be open about all the facts of a situation in the context of healthcare. And you are immediately going to see that as we talk about a moral duty here, we are conceptualizing that within the framework of deontology. So this principle here is going to tell us what the right things to do are in themselves. In this case, is the value of telling the truth. We say that telling the truth has a moral value, and it's a value in itself. So it will have inherent value. It's inherent to the action of telling the truth that it's good. So we have the duty to perform that good action. In the context of healthcare, veracity refers to the obligation of telling the truth about a diagnosis and the corresponding prognosis to a patient, even if the healthcare provider is conflicted and would like to spare some details to their patient. They still have the obligation to give them all of the information about their condition, as well as the information that they need in order for them to make decisions about the course of treatment. So there, as you are not going to be surprised, are going to be often conflicts between different principles in the context of healthcare. And we've already seen how beneficence could be in conflict with many other principles. And it's quite often that principles from consequentialism will conflict with principles from deontology, even though sometimes, remember, they're going to give overlapping prescriptions. In this case, it's a common situation of a moral dilemma where we need to pick between veracity and beneficence. So we said veracity tells us that there's something inherently valuable in telling the truth. However, according to beneficence, telling white lies is often the better course of action than telling the whole truth. So we say that is justified on the basis of beneficence. So as long as our lie brings about good consequences, let's say we lie to our patient that they have a more optimistic prognosis, and that motivates them to comply with the treatment, they're still going to do better than if they weren't motivated, but we may have exaggerated the potential benefits. So in that sense, this would be a white lie that would lead to good consequences. So it will have beneficial results. So beneficence is going to justify lying in this case. So you're going to recall that beneficence is a principle that is spelled out within a consequentialist framework. So here you're going to clearly see the clash between deontology, which prescribes veracity, and consequentialism, which would prescribe beneficence. So here's another case in which beneficence may go against veracity. What we call benevolent dishonesty refers to the situation in which we're being dishonest. So we're lying, we're not telling the whole truth, we're withholding some information, but we do that in a benevolent way. So we mean well, we have some good intention. We're saying this because that's going to do good to the patient. So here you're going to see how benevolent dishonesty is going to put together beneficence and virtue ethics. So consequentialism and virtue ethics here overlap with that case of benevolent dishonesty. So on the one hand, beneficence tells us be dishonest because that's going to benefit the patient, and in the other case, virtue ethics tells us, well, just be mindful, just have this intention to help your patient, and if that requires dishonesty, do that. So here you get the idea how the value of telling the truth becomes an important principle in ethics, and in our case in biomedical ethics. So healthcare providers will have that obligation to tell the truth. So here's a related principle. That's the principle of fidelity. When we talk about fidelity, what we mean is we ascribe some moral value to keeping promises or being loyal. We often talk about fidelity within a relationship, for example, and the way to think about it is when people enter into a relationship, what they do is they promise in some way, whether explicitly or implicitly, to have certain attitudes to one another. So it's assumed that in a relationship, if you promise something to your partner, you're going to keep that promise. Also, the notion of loyalty appears in that kind of relationship. So we say, when I am in a relationship with somebody, I am being loyal when I put a priority on that person compared to other people. So when I have to make a choice, and if it has to be a moral choice, I will side with the person that I have that relationship with. So here we're saying that according to the principle of fidelity, we have the duty, and it's a moral duty, to keep our promises and be loyal. So again, we're talking about duties. That is deontology. So here we're talking about a framework of normative ethics that relies on rights and duties. So the people that we're in a relationship with have the right for us to tell them the truth, and we have that obligation to do so. If you think about it, what we have in the context of healthcare, we have a very specific kind of relationship. So we have a patient and we have a healthcare provider, and they are defined, these two roles are defined in terms of a relationship, because a patient could have many other aspects to their life and their person, the same with a healthcare provider. But when we identify them as such, we know that we're putting them in a relationship. So the relationship between patients and healthcare providers clearly comes with the obligation of the healthcare provider to provide services that are life-saving or healing. That is an obligation that the healthcare provider has already committed to when they became a healthcare provider in the first place, and to this particular patient when they took them in. It's also, the case could also be made that patients have obligations to their healthcare providers, such as they agree to be on time for their appointments, they agree to comply with the treatment that they have selected together with their provider. So if a patient is not compliant and then they blame their healthcare provider for not being competent enough to treat them, there obviously is a breach of that kind of fidelity. So the patient's not doing their part. But most of the obligations here do fall on the side of the healthcare provider. So it's not going to be uncommon that conflicts of interest are going to arise in the context of healthcare. So loyalty is obviously due to the patient, but also patients owe loyalty to their providers. So if it turns out that one or the other part is not doing their part, then there's going to be that kind of conflict of interest. they will be looking after their own interests and not being loyal to one another. So that's going to be a breach of fidelity. Here's another case in which a healthcare provider may be conflicted. So the healthcare provider clearly has that obligation of fidelity towards the profession, not just the patients, but also as a part of that profession. The healthcare provider makes the commitment to be loyal to their colleagues. And then in cases where unfortunately some healthcare providers are being dishonest, their colleague will be conflicted. Well, should I expose them and be loyal to the patient, or should I preserve their confidentiality and be loyal to them? How is this going to affect the future of the profession and the future of healthcare in this facility? So all of these questions are going to arise in the context of fidelity. Another point, unfortunately, there are incompetent colleagues in every profession. So in this case, again, the healthcare provider may be conflicted between the interests of the patient, but also defending the interests of the institution where their colleagues are operating, but not providing the best care that they should. So this is how fidelity works. There is a kind of relationship. Two parties make a commitment to one another, whether that's going to be equal commitment the way we have in intimate relationships, or that kind of special obligations that we have in the context of healthcare between a patient and a healthcare provider. But in any case, there are those commitments that are being made, and specifically being loyal and keeping promises that you make within that context.